สวัสดีค่ะ Hello. You are with me, Adisa Saprasert. Today, we are going to find out whether the advances in medical science and technology will enable humanity to live a longer life. Today, with precision medicine, doctors can detect disease in patients at a very early stage, which would that mean it allows for early treatment? And would that also mean there is a better chance of recovery? Today, we have Dr. Manop Pithukpakorn, Professor of Medicine and Clinical Staff at the Faculty of Medicine, Siriraj Hospital, to help us understand what exactly is precision medicine for us to have a better understanding. Please welcome อาจารย์มานพค่ะสวัสดีค่ะอาจารย์
ครับสวัสดีครับ
อาจารย์คะ I would like to ask you what exactly is precision medicine?
This is I would say right now the word precision medicine is kind of buzzword at the
Buzzword.
moment. I think it's because people are seeing more impacts on this new principle. I would say the precision medicine is a new principle in understanding how our health works, and also how could we adapt this knowledge to better healthcare and better health promotion and prevention. Starting from the concept in the past until now, that we look people as the same. Once we become ill with certain diseases, when we know the certain diagnosis, we tend to use or adopt the treatment guideline similar for everyone. We now know better that even though the patients that have the same diagnosis, they are pretty diverse in terms of the cause, and also in terms of the treatment response. If we understand these differences in the basic knowledge or fundamental of each patient and disease, we can tailor-made the best treatment plan to every single patient.
So, what you mean is like precision medicine is a tailored treatment to many kind of diseases. It doesn't limit to only broad blood pressure, but also high cholesterol. And what I heard is also cancer. Is it correct?
That's correct.
And what are there any other diseases that can be treated by precision medicine?
We believe that in the future, every single disease that human will have will go towards that precision medicine principle.
Oh,
Look at the as basic as infectious disease like pneumonia or septicemia or any joint infection, something like that. Uh, we adopt this principle for a long time, but we don't know, and we never really realize it. For example, in a patient that have an infection, what we want to know that what's the organism that caused those infection. If we know the organism, then we could prescribe uh, the medication or antibiotics that fight those infections.
oh,
Even though they have the lung infection, but the organism that cause infection could differ. And that's the basic principle. We could adapt the similar concept to other diseases, for example, cancer. Even though they have the diagnosis of cancer, for example, lung cancer, each lung cancer patient have differences in that we call genetic changes that drive a normal cell into the cancer cells. And
okay.
if we know the certain or particular genetic changes, we could choose the particular drug that acts specifically on those changes.
If today the Thai people would like to go and be treated with this treatment, can you tell the price? How much would it be? Since I think it's still new.
The cost of technology it's getting cheaper all the time. Now, obviously, it's still consider a little bit more expensive than the other treatment or even testing. Currently, to do this kind of test in particular condition like cancer, it costs about several thousand to to about 100,000 bahts a test. But in the future, it's getting much cheaper. We're looking at around several hundreds or even a
300.
few thousand bahts a test. Uh, and yeah, and in the future, this test could become a widespread. You could order it, or you could find it in every single hospital or even clinics,
Oh,
and to get this test done and use this information to prevent ourselves from getting sick, or even choose particular or most suitable foods or even medicine that we can use in the future.
ค่ะอาจารย์ thank you for clarifying this to us today. It is very informative, and I'm very happy to hear that today people will be with with this technology, people could live a little healthier life, right?
Yeah.
ค่ะอาจารย์ thank you for your time ค่ะขอบคุณนะคะ